You paid into Medicare your whole working life. Yet most retirees use a fraction of what it actually covers. There are benefits sitting right there in the rules, already yours, that nobody ever points you to. Your insurance company is not in a hurry to remind you either. Today we walk through 20 real Medicare benefits, the kind people overlook year after year. This is not a loophole. This is the law. Your law. Let us go through it slowly, because the details are where the money lives. First, a little honesty about the history. Medicare did not exist when many of us were young. It became law in 1965 and the first folks signed up the following year. So the program is younger than people think, and a lot of these benefits were added much later. That matters because it means the rules keep growing. New coverage gets quietly tucked in. The trouble is, nobody mails you a friendly note when a new benefit shows up. You have to know it is there. That is what this list is for. Benefit 1 is the annual wellness visit. Part B covers it once a year, and when your provider accepts Medicare assignment, it costs you nothing. People skip it because they confuse it with a full physical. It is not that. It is a planning visit where you and your doctor map out your health for the year. There is also a separate welcome to Medicare visit in your first year on Part B. 2 free conversations with your doctor, and most people never book either one. Put it on the calendar this year and use it. Next come the preventive screenings, and there are several. Part B helps cover screenings that can include colorectal cancer, mammograms, cervical cancer, and lung screening for those who qualify. It also covers cardiovascular and diabetes screenings depending on your risk. The whole point of these is to catch trouble early, while it is still cheap and easy to treat. Many of them carry little or no cost when the rules are met. They are written into the program, waiting quietly for you to use them. A screening done on time can change everything after. Most people simply never ask. Vaccines are next, and the rules here got better recently. Part B covers certain shots like flu and pneumococcal. Part D covers many other recommended adult vaccines, and recent changes removed the cost for a lot of them. That means shots you might have paid for before could now be free under your drug plan. This is exactly the kind of update nobody announces. The coverage changed quietly. If you do not check, you keep paying for something the program now hands you at no charge. Ask your pharmacist what your plan covers before your next shot. Now 2 benefits that go together, both built around managing a condition instead of just treating it. Diabetes self-management training teaches you how to handle diabetes day to day, when your provider orders it. Medical nutrition therapy gives you sessions with a registered dietitian for conditions like diabetes and kidney disease. These are real services, covered when referred. They are not a pamphlet shoved at you on the way out. They are hours of real help that most people never even hear are an option. If you live with a chronic condition, ask your doctor for a referral. Here is one that can put real money back in your pocket. Medicare savings programs are run by your state, and for people with limited income and resources, they can help pay your Part B premium. Some even help with deductibles and co-insurance. The programs go by names like QMB, SLMB, and QI. Many people who qualify never apply, simply because they never knew these existed. If your income is modest, this is worth checking. You may be eligible, and the savings show up every single month. Your state office can walk you through the application. Right alongside that sits extra help, also called the low-income subsidy. This is federal help paying for your prescription drugs, and Social Security runs it. For people with limited income, it can sharply cut what you pay at the pharmacy counter. Drug costs are one of the biggest worries in retirement, and this program exists exactly for that reason. It is already yours if you qualify. You just have not claimed it yet. Many people assume they earn too much and never even check. Apply through Social Security and find out where you really stand. Benefit 5 on our running count is the one I wish everyone used. Every state has a SHIP, the State Health Insurance Assistance Program. It gives you free, one-on-one Medicare counseling from someone who is not selling you anything. No sales pitch. No commission. Just a real person who helps you understand your options. They count on you not knowing this is free. That stops today. When you have a Medicare question and you do not trust the answer, this is who you call. Keep the number for your state shipped somewhere you can find it. Telehealth is next, and it has become a quiet workhorse of the program. Medicare covers a range of visits you can do from home, by video or sometimes by phone. For anyone who lives far from a clinic, or who just has a hard time getting out, this is a genuine gift. The rules around telehealth have shifted over the years, so this is one to double-check for what is covered right now. But the benefit is real, and it spares you a long, tiring drive. Ask your provider which of your visits can be done by video. Now to the equipment side. Part B helps cover durable medical equipment, the gear that keeps you safe and independent at home. We are talking walkers, wheelchairs, hospital beds, and oxygen equipment when your doctor prescribes it. This is not a small thing. The right equipment is what lets people stay in their own house instead of somewhere else. The rule is written down. Most people just never read that far. If you need it and a doctor agrees, the program is built to help. Talk to your doctor about what you actually need at home. Two more home-based benefits belong together. Home health care can cover skilled nursing and therapy delivered right to your door, for people who qualify as homebound and meet the rules. And hospice care covers comfort-focused care for those who are terminally ill and choose it, including real support for the family. These are some of the most compassionate parts of Medicare. They are also among the least understood, and families often discover them far too late. Knowing they exist, before you ever need them, is what lets you use them well. Ask your doctor whether you meet the rules. Let us talk about mental health, because Medicare covers more here than people expect. Outpatient mental health care is covered, and in recent years the list of providers you can see has actually grown. For a generation that was often told to just tough it out, this matters. Anxiety, depression, and grief are real, and getting help is not a weakness. The coverage is there. You do not have to carry it alone, and you do not have to pay out of pocket for care the program already includes. Next come two rehabilitation programs that quietly change lives. Cardiac rehabilitation is a supervised program for people recovering from certain heart events or conditions. Pulmonary rehabilitation does the same for people with certain chronic lung conditions. These are structured, monitored programs that help you get stronger safely, with professionals watching over you. They are covered when you qualify. Many people finish a hospital stay and never learn that this next step, this real chance to rebuild, was theirs to claim all along. If you have had a heart or lung scare, ask whether a rehab program is open to you. Now a quick run of smaller benefits that add up. Medicare covers counseling to help you quit smoking or tobacco. It covers bone mass measurement to check for osteoporosis if you are at risk. It covers obesity screening and behavioral counseling for those who qualify. None of these make headlines. But each one is a real service, written into the program, that can keep a small problem from turning into a big one. A short counseling session today can spare you a hospital bill tomorrow. They are there for the asking. Most people just never ask. The last benefit is the one that protects all the others. Every year Medicare puts out the Medicare and You Handbook, and there is a free plan finder tool online. During open enrollment, that tool lets you compare plans side by side so you do not overpay. People stay on the same plan out of habit and lose money quietly every year. Spending an hour here can save real dollars. The information is free, official, and waiting for you. You only have to open it. Step back and look at what we covered. None of this was a trick or a secret backdoor. Every one of these is a documented benefit, paid for by the taxes you handed over for decades. The hard part was never qualifying. The hard part was simply knowing. Insurance companies and busy offices have no reason to walk you through the full list. So the job falls to you, and now you have it in hand. Knowing is the whole game. You just did the hard part. Here is your next step, and please take it. Do not rely on memory, and do not take my word as the final answer. Coverage and eligibility change every year. Go to Medicare.gov or call 1-800-Medicare or sit down for free with your local SHIP counselor and check your own situation. Bring this list with you. Ask about every benefit that fits your life. You paid for all of it. Now go make sure you are collecting every dollar the law entitles you to.